Hi there, my name is Susan O'Kelly with Avanti Health First. And you are here because you have questions about Medicare and when to enroll, how to enroll, and what to do, how to do it, along with the alphabet soup of Medicare in general. So welcome to my presentation. I want to say before we start, please get a piece of paper and a pen or pencil so that you can take notes. I also know that I have a tendency to speak rather quickly. I will have an opportunity in between with my internal clock saying, hey, we want people to know this, and I'll stop and take a breath and point out a section that I want you to specifically write down. At the end of this webinar, guess what? I have a couple of bonus items for you, and this will also help. I have a customized roadmap because I'm going to be talking about how important timing is. Timing is going to be critical and key to doing things the way they should be done and when they should be done properly. And I'm going to also give you a worksheet. So you'll jot down numbers and pricing that I give you, and then you'll put that into the worksheet, and it'll help give you an idea, well, what would this cost and how would this look if I did that over this other thing over here? So if you're ready, you have your piece of paper, you have a pen or pencil, and you've written 2024 Medicare 101, we are ready to get started. So let's talk about Original Medicare Part A and Part B. So for most of us, Original Medicare Part A, the hospital coverage, should be $0 premium per month because we've worked at least 10 years and paid into Medicare. Now that does not have to be concurrent. So you could have worked early and then taken a break and then come back to the workforce. As long as you've contributed for 10 years, it's expected that your Part A premium will be $0. Part B premium should be $174.70 per month for 2024. That's the doctor coverage. And I say should be. Why? Because there are some income adjustments. And let's take a look at the income-related monthly adjustment amount and how that works. And before your eyes roll into the back of your head, this is a fairly easy chart once I explain it. And let me also say, my passion is teaching people to be better insurance consumers, and you are taking the first step. Let's take a look at this chart. So it's 2024 Medicare premiums. If you were enrolled in Medicare Part A and B, and your monthly income fit into one of the two buckets on the top row, your Part B premium would be $174.70. Okay, notice the top of the columns. You might be thinking, well, that says 2022. That's because there's a 2-year look back by the IRS. So we are in 2024, it looks back 2 years and compares what was your income at and then puts you into the proper bucket. Does that make sense? All right, so if you have higher income, you can look at rows 2 through 5 and kind of see where you fit in those brackets. And you'll notice there is a Part D premium column. That's because our drug plans also are associated with an income-related monthly adjustment amount. I don't want to get too deep into the weeds here. I just want to plant the seed so that you understand how premiums are going to look. I will tell you that one of the things that I see trigger an IRMA, an income adjustment, happens when maybe there's a golden parachute. You retire and your company gives you, a 30-year gift for all of your hard work. The other time I see that is when we see real estate being sold. Maybe you're downsizing and you've had capital gains. There are ways to deal with this, so make sure you jot that down as something to call me about, and we can help give you some guidance. You will work with your tax advisor or your CPA, and I'm happy to point you in the right direction. Okay, let's move on. So how do you enroll? Let's get to that. If you are currently on Social Security benefits, then it's super easy. About 3 months before you turn 65, you're going to get a card in the mail saying, welcome to Medicare, Part A and B. It'll be 65th birthday, and there you go. $174.70, the magic number, will come out of your Social Security benefit check. It's very, very simple and not very disruptive. Now, what if, for some reason or another, you're not on a Social Security benefit or automatically enrolled? So that means you're going to manually enroll. And I see this happen when people decide that they don't want to trigger the Social Security benefit, but they're turning 65 and they're going to take the health insurance benefit. So let me be clear. We are talking about Medicare health insurance enrollment, not your Social Security distribution. So take note. I've got it down here in gold, www.ssa.gov. I'll let you catch up and write it down, www.ssa.gov. It's fairly simple to enroll manually, and you'll have options that allow you to say, no, I don't want to take my Social Security benefit. Not a big deal. If you have any questions, just give us a call. We're happy to help. So when you enroll manually, Part A and B, you get it done 3 months before your birthday. You are going to be billed quarterly. So there's not an error. It's still $174.70, but you are billed quarterly. Just understand that so you don't get sticker shock. Now, if you are still working and you have a really great employer plan and you turn 65, it's still great. What will happen is if you are working for a larger company, most of the time your Part A enrollment is handled automatically behind the scenes. It's done for you, and you just leave the Part B alone. Now, here's where timing is important. Again, if you're keeping that group plan because it's really great, not a problem. Keep that group plan. However, 3 months before you retire, that's the time to get out your little roadmap and put on there, call Susan. Because we're going to need to make sure that timing is happening the way that it should be to avoid late enrollment penalties. And we'll get into that in just a moment, just planting the seed. So you have a great employer plan and you're ready to retire. 3 months in advance, you're going to enroll in Part B with a special enrollment period, but also take note at that little asterisk at the bottom of the page. Oh, my head's in front of it. The HSA, the Health Savings Account. If you and your employer plan are contributing to an HSA account, you need to stop contributing 6 months before you retire. Otherwise, you'll have a tax liability. I don't want to see anybody be subject to tax penalties. Make sure that if you are on an HSA, jot that down, that you need to stop the HSA contributions. You can still use the items in the money that's in that HSA account. Book an appointment with me. We'll walk through that if you need some advice on where to go next and what to do. But you just can't contribute. Mark that down. Stop contributions to HSA 6 months before Part B enrollment. Okay, let's take a look at what we've covered. We've talked about step 1, enrolling in original Medicare Part A and B, and you can stop there. So the rest of this presentation is, well, what if I don't want to stop there? And what are some of the implications, and what are some of the costs, and what are some of the benefits? So let's take a look at that. You're going to enroll in original Medicare Part A and B. Let's assume A and B at the same time, 3 months before you turn 65. You log into SSA and get those things started. While that's happening, you're going to be thinking about, what path do I want to take? Do I want to take the Medigap, the Medicare supplemental path, and a separate drug plan? Or do I want to take the bundled path, where I go into a Medicare Advantage plan that adds my drug coverage? Let's talk about those right now. It's all about timing. If you choose to do nothing and you don't enroll in anything, including Part B, what did I just say? Late enrollment penalties if you don't do that. And this is where I see it happen. We come off of an employer plan and we don't get that special enrollment triggered properly. Timing. I don't want to see anybody be subject to a late enrollment penalty because we didn't get the timing right. And that penalty is 10% per year. It's a 12-month cycle forever. So timing. Understand that late enrollment penalty for Part B. And that leads us to what we're going to be talking about in a moment, that Med Sup and the Part D. If you don't enroll in a Part D drug plan, and this mostly has everything, it's related to this working and coming off of an employer group plan. This is where I see these enrollment penalties get triggered. So your Part D enrollment penalty, look at that number, it's 1% every month. And I know what you're saying. Oh, I don't take any prescriptions. I don't need a drug plan. Let me just revisit this idea of going 10 years or 12 years without a Part D drug plan. Now you're 80 years old, and there's probably some, I mean, maybe you're not on any prescriptions, but even if there's just one prescription and you get pulled into the prescription arena, now you're subject to penalty. And let me just put it into this sort of a scale. If you pay a $0 premium drug plan every year, because there are $0 premium plans that give you drug coverage that's acceptable, versus waiting until you're 80 years old and you're paying $80 in penalties every month, I just want you to consider that thought. So if I go back a few screens in the thought process, I see this happen with my people that are working and then decide to retire. There are some steps that have to happen. Make sure to jot those down in your worksheet and your roadmap. Timing will be critical. All right, enough doom and gloom. Let's talk about the major exposures of original Medicare. If you did nothing and just stopped at Part A and B, you have Part A deductible for the hospital is $1,632 every hospital stay for 2024. And your Part D drug coverage, the deductible is not that bad. It's only $240 for the year. However, line 2 and 3 are kind of scary. That coinsurance is 20%, and there is no limit. So if you have a major health event and those Part D coverages, your doctor out of your not hospital, but your other coverages that are handled by the doctor, 20% can be a lot of money. $100,000 in fees, yeah, that's $20,000. And then there's also the excess charges. So if your doctor takes original Medicare billing and you don't have a Medigap plan or a Medicare Advantage plan in place, they can charge you 15% above the standard rate. So these are some considerations. What does that really mean? It means that there's gaps in Medicare Part A and B. How would you fill those gaps? That's why you're here. We're going to talk about Medicare supplement plans and Medicare Advantage. I've already hinted that they are out there on that roadmap. What does that really look like? Well, let's compare them. So Medicare supplemental is going to have the lower out-of-pocket costs, which means that it's easiest to budget. The Medicare Advantage plans have higher out-of-pocket costs, so they're more difficult to budget. But that next line item talking about premium, the Medicare supplemental plans are much more expensive by comparison. And in addition to the supplemental plan, don't forget, you have to purchase a drug plan because you don't want that late enrollment penalty that I was talking about. If you choose a Medicare Advantage plan, there are many Advantage plans that are significantly less expensive than the Medicare supplemental. And currently in 2024, there are many $0 premium plans. So when you start to think about that second line item, remember, you still have to pay for your Medicare Part B, the $174.70. If you're on a Medigap policy, and I'll give you some pricing a little bit further in, you have that plan premium and you have the drug plan premium. Yep, 3 separate policy premiums. If you're on the Medicare Advantage side of the house, you would have your Part B premium, $174.70. And then if you're on a $0 Medicare Advantage plan, you're done. You have nothing else. So it's sort of like a teeter-totter, if you will. How do you want to budget your household expenses? So that's the budgeting part of the conversation. The next item, the line item there, that's third line item talking about networking, network options. So in the Medicare supplement arena, you can go anywhere you want to in the U.S. as long as the physician and the hospital accepts original Medicare billing. I always coach my clients. They go to their favorite doctor and talk to their favorite receptionist, and you call and say, "Hey, I'm going on Medicare. I'm really excited. Do you take Medicare?" And they say, "Oh, sure, we take Medicare, no problem." Well, we need to be talking the same language to everybody, and I would really, really suggest you write this down. If you talk to your doctor's office and inquire about Medicare, I'm getting ready to enroll in Medicare and I'm considering my options. Do you accept original Medicare billing? I'll repeat that. Do you accept original Medicare billing? If your doctor's answer is yes, then great. A Medicare supplement is not a concern in terms of billing and being able to see your favorite doctor. On the Medicare Advantage side, many organizations, private practices, group practices, they take Medicare Advantage. They contract with the insurance companies. The only caveat is that if you have to go to a doctor that takes the Medicare Advantage plan that you like. And there are a lot of plans out there, and the doctors and group physician practices contract usually with several, not just one. But you are going to want to check and be sure that you know which plan your doctor's office prefers and which plan they take. Now, that said, remember the Medicare Advantage plans, or maybe you didn't know this, I shouldn't say remember, but know that the Medicare Advantage plans have networks. It's just like your employer group plan, the group insurance, you have an HMO option and a PPO option. And as you're probably familiar with, HMOs require referrals for most plans. Not every plan, but most plans. If you're on an HMO, there's going to be a referral required. PPOs, not so much, but understand that those big variables between Medicare Supplemental and Medicare Advantage with regard to network. And then last but not least, if you're on the Medicare Supplemental path, you're going to need to pick up a drug plan. Please pick up a drug plan. Don't get late enrollment penalties. All right. Option 1 details. What does it mean to be on a Med Sup? We've talked about the hospital and medical coverage. We're going to talk about drug plans in just a moment. So focus on this center icon here. So what happens is that the Medicare Supplemental picks up pretty much everything. Most Medicare Supplemental plans will pick up everything. All those co-pays, that hospital fee, etc. The drug plan we'll talk about. Here's what happens with your Part A drug coverage on the Medigap policies. It goes away, magically disappears. And the Part B doctor coverage on most Medigap policies, the only thing you pay for is the deductible, the $240. Now, on one of the plan options I have, the excess charges don't disappear. I'll point it out to you. Don't worry. So in general terms, though, a great reason to have a Medigap policy is that those exposures to those higher costs, that per hospital visit, the excess charges, that 20% co-insurance. If you did nothing else, you'd be stuck with that if you at least make some conscious decisions about how you want your health insurance to work for you. This is the first step. All right, let's talk about plans. Again, a very busy screen at first, but let me teach you how to read this. The heading says 2024 Medigap plans, and then the column headers are the plan codes, A through N. The most popular plan codes are G and N, and you will notice that N is that one plan that doesn't cover excess charges. But all the other plans, we've got great coverage limits. Excess charges can come back and haunt you, but I don't, there are other things to consider, and absolutely for each unique situation, let's go through them. I want to focus on Plan G and Plan N because they are the most popular, if that's okay with you. Oh, and a word about Plan F. If you were eligible for Medicare because of your birth date, and you were eligible before January 1st, 2020, you can still enroll in a Medigap Plan F. It's very rare. Plan G and Plan N are great options. So talk about that, write that down, talk to Susan about Plan F, and get the details. I'm happy to review that with you. Okay. Key elements. Best time to enroll. How many times did I say 3 months before your birthday? But guess what? On a Medicare supplemental, you can enroll in a Medicare supplemental plan 6 months in advance of your effective date, right? So my birth month is August. If I were going to enroll in original Medicare Part A and B, I would start that enrollment process in May. If I'm going to enroll for an August 1st start date, if I knew that I wanted to enroll in a Medigap plan, I would start my Medigap plan process way back in March. Why? Because I can get the rates locked in. So if I'm allowed to do that and I want the Medigap plan, I'm going to do that in March for an August 1st effective date. Get the lowest rates. And of course, you're going to avoid mistakes if you start early, and you're going to check it off your list. If you're like me, when it's done, I breathe a sigh of relief. And I've already talked about, no, I haven't talked about standardized plans. So standardized plans, if you're on a Plan G with your favorite insurance company and your best friend is on Plan G with a different company, your coverages are the same. Plan G is Plan G is Plan G. You have no excess charges. You have 100% of your hospital paid on those deductibles. You have a $240 Part B. It's Plan G is Plan G is Plan G. And any of the plans are like that. If you select a Plan N with your favorite carrier and your best friend chooses Plan N, the only difference in the Medigap policies is the premium. Everything else has to be standardized according to the federal government. So, all right, let's talk about Plan G and Plan N in detail. Here's where you might want to jot some notes down in terms of pricing. So I've kind of fleshed out the idea that the average cost for Plan G, depending on your zip code, is somewhere between $100 and $200 a month. Let's just take the difference. Let's just call it $150. Write $150 down. So you're going to pay $150 for your Plan G. Don't forget your $174.70. And then you have a $240 deductible. You're done. Something bad happens, that you're done. You have very, very controllable budget numbers. You're done. Plan N. Your premium's about $20 less. So let's throw $130 on your little worksheet that your notes that you're writing. So that's your monthly premium. Don't forget the $174.70. And then, well, of course, you have the $240 deductible, but then know that you have co-pays for doctor visits as well as ER visits. And as I pointed out in that other chart, Plan N, you have your excess charges. That's that 15% over and above the standard charge. But when you start thinking about budgeting, these are important concepts and important thoughts to have so that your timing is correct, timing, and that you're making a decision. You have a plan and you have guidance as to what you want to do for your action plan. All right, the prescription drug plan, we're not going to spend too much time here because they're very, very simple. It's additional premium, and you can throw $35 on your little notepad. Just put that into your chart so you can keep track of numbers. It is a separate plan. Let's talk about how to plan the prescription drug plans work, however. So the prescription drug plan has its own separate deductible. Most of them have a deductible. Not everyone, but most of them do. So you pay for the plan premium, then you have your drug deductible, and then the next thing that happens is the initial coverage stage. So you're paying for your drug copay, $10 a month. Well, if you have a really expensive drug, and you now spend over $5,030 in 2024, you go into what we call the donut hole or the coverage gap. And at that point, you pay 25% of the copay. So if you had a $100 drug, you paid $25 instead. And when you reach $8,000 out of pocket, you're in the catastrophic stage. Oh, and my head's covering it again, but that says catastrophic. Trust me on that. You're in the catastrophic stage and you don't pay any other cost sharing. Now here's a little bit of a teaser. We're in the 2024 plan conversation. 2025 drug plans are changing dramatically, and it has a trickle-down effect on Medicare Advantage plans as well. I have another webinar. Search on my name. Make sure you get signed up for that so you know how that works for you, because we're going to talk in October, November, December, and prepare for 2025. And the drug plan changes in the webinar are really interesting. We no longer have a donut hole. The maximum out of pocket is different. And that's all I'm going to say. Sign up for the webinar. So understanding Part D is also an important piece to your Medicare journey as you get ready to enroll. My process. So we will check the prescriptions that you're interested in us looking. We don't demand that you provide us with your drugs. We're not allowed to. But if you would like us to specifically look up prescriptions and try to help create that budget for you, we'll search that out. There's a tool that we go online with Medicare and get that information as to what the drug costs are. And then you're gonna tell us your pharmacy. And then what we'll do is we'll look at all of the plans available in the zip code, and it'll spit out information based on your budgeting and how much these prescriptions cost. And they could be different on different plans. The drug formularies are different. We'll get you prepped to enroll in a Part D drug plan. Remember, this is all happening in that 3-month cycle ahead of your 65th birth month, and then we don't stop there. You're going to hear from me again. We're going to reevaluate every year between October and December. Now, we typically like to book our appointments October 1st because we can get a jump on information. We can't enroll you in any plan changes until after the 15th. But we'll talk to you in September, October, and start planning. And if you need to make changes for whatever reason, whether it's cost, whether it's formulary, whether it's ease of use, we're happy to help. Let's talk about Plan G Medigap summary. $174 a month, $174.70 per month. We're going to throw our dart on the board in today's webinar for $150 for Plan G. And then we're going to throw $35 on the board for your Part D standalone drug plan. Are you with me? Let me take a breath. Okay, let's talk about Medicare Advantage. We're going to dig into the details on the Medicare Advantage plans. So you can kind of see from this graphic that we still have original Medicare, but the Part D prescription drug plan is often bundled into the Part C. We also call Medicare Advantage Part C. And this is great for our vets because a lot of times the veterans, they have access to VA coverage, they have TRICARE for life. Maybe our vets are going to love the benefits of a Medicare Advantage plan. They don't need the drug plan. Perfect. There are many $0 premium plans in the Medicare Advantage arena, whether or not you're a vet. So the Medicare Advantage plan has this coordination of care. It's also private insurance. There are a lot of different benefits that get added into these, and let's take a quick look at some of that. Some of those additional services, I don't have it on this slide, but things like dental and vision and hearing, there are additional benefits. So there are a great deal of Medicare Advantage plans, and if you remember that comparison, I'm going to come back to it in a moment, thinking, what do I want to pay? Do I want to pay more per month and have it just taken care of, or do I want to pay less per month and just deal with those costs as they crop up, right? So what are the key elements for Medicare Advantage? Best time to enroll is 3 months in advance. So you're going to be working on the original Medicare Part A and B, and then you're going to be talking to me about getting comparisons, and we're going to think about enrolling you so that everything has that timing, all enrolling on the same effective date. This helps you avoid mistakes, and this helps get it done and checked off your list. I've already talked about standardized plans for the Medigap and similar in the Medicare Advantage arena. They are also subject to federal oversight, and in this world, the Medicare minimum requirements, this bucket over here, they are all the same. Doesn't matter whether it's your favorite carrier versus your best friend's carrier, there's minimum coverages that have to be in place. Now that said, plan premiums can vary, co-insurance, co-pays, deductibles, they can all vary. And also the additional benefits like dental and vision and hearing and grocery and silver sneakers and all those things that can get thrown in and moved around. So that's where the Medicare Advantage plans begin to differentiate themselves. In either case, whether it's a Medicare Advantage or a MedSup, it's always about your lifestyle and the triggers that work for you. How does your health insurance work for you so you're happy and enjoy doing other things than worrying about Medicare? All right, to summarize, remember $174.70 Part B, it will still be with you. The plans vary by zip code. I already mentioned that the co-insurance, co-pays, deductibles, etc., but there are still many $0 plans. And then the drug plans are often included. They're not separated out. Unless you want them to be, they're not separated out. So when do you sign up? We're almost done. Well, initial enrollment period, if you're turning 65, is that 3 months before your birthday. And we already talked about exceptions to the rule. If you're still working, you're on a group plan that you really like, we'll work with you and help you understand your unique situation. But for general purposes for today's webinar, consider the 3 months in advance is when you start on this process. That way you get it done early and get it checked off. Now that's not the last time that I'm going to be talking to you, because we're going to have annual open enrollment periods, AEP. So let's say you enroll in a plan now and you get through a couple of months and we're getting into, the AEP period. That's a great time to take note of what didn't you like about the plan? What do you wish the plan did for you differently? Because we can enroll you in a new plan effective January 1st. AEP is always October 15th through December 7th. Let's do one final comparison for you to take notes. Medicare supplementals, they're easier to budget, but they do have a higher cost for monthly premium. The Medicare Advantage plans are great because they're, lower cost, a little more difficult to budget for, but they have a network. So you probably have referrals. On the Medicare Advantage plan, you're going to have more costs per month because you have to have a standalone prescription drug plan. So I just wanted to show this slide to you again so you can catch up on your notes and just see where you were at. We're about to wrap it up. You started phase 1 by participating in today's webinar. We taught you a lot. It was a lot of information all at once. Phase 2 comes next. That's when you book a consultation. My appointments are always free. I've never liked that word consultation because it implies that there's fees later. There are never any fees. We don't charge a fee. The insurance company compensates us. They give us a fair commission. That way, I can work with you so you can find a solution that fits what you need, your family, and your lifestyle. We're going to help get that process in place for you. And as I said, I have 2 additional bonus items. I've got a roadmap for you so that timing is in place. And I've also got a worksheet summary that you can use and plug those numbers in. It will help you calculate, just round everything up into one place and really take a look at how does it feel for you in terms of what you think you want, your wishes and desires, and what the reality of pricing and budgeting is going to be. Now, I'm not done with you yet because I have free lifetime billing and claims services. My passion is to make sure that you are as educated as possible, but when things go wrong, we are here to help you. And it's my mission to make people better insurance consumers, but we're going to be here for you. We're going to have those annual reviews before AEP. What do you do next? Well, if this was helpful to you, I'm going to ask that you share this information with your friend, your neighbor, your family, because Medicare can be very confusing. The trick is to find an agent that is really compelled to teach people the different parts so that it's not a mystery. What do? Schedule an appointment with me. Get your bonus items so you can get cracking on this. Let's get started. I know you have a very busy schedule, and I appreciate the time you spent with me this afternoon. You can either use the QR code and book right on my calendar, or you can click on the phone and call us, and we'll get you on the calendar and walk through the intake process. It's really simple. Thank you so much for your time. Let's get started.